Hey everyone, Tony Maritato here again. I get a lot of questions about recumbent bike, stationary bike, using a bike to improve range of motion. Let's talk about using a bike. Let's dispel some of the myths and let me share a couple of my favorite little tips and tricks to help make it a little more manageable and maybe even enjoyable. So let's talk about the bike first. There's two main kinds of bikes. This is called a recumbent bike. A recumbent bike essentially has a backrest that you can lean into. The seat is adjusted front to back, whereas a stationary bike, there's typically no backrest, and the seat is more above the pedals. So most commonly in physical therapy, you'll have the option to choose either a recumbent or an upright bike. This video is going to focus on the recumbent bike. My next video will focus on the upright bike. So how do we position ourselves within the bike to have the bike fit you appropriately? Well, obviously, if you can't reach the pedals, the seat's not close enough, right? So what you're looking for is you're looking for kind of that sweet spot where you are as far back away from the pedal as you can be, but you can still make a full revolution. And this is where you see that stretch. Now, if you're limited in that range of motion, you're gonna have to move still a little bit closer. But the closer you get, the more flexion you're gonna need. So there's always gonna be that trade-off. A couple little things that patients don't necessarily realize before they get on the bike is that, guess what? You have an ankle, and that ankle can bend and flex and extend, and it can reach and it can retract. So when I'm out at the furthest point of the cycle, I could point my toe and gain a couple extra inches of reach as I come around. Now, as I come to the flexion part, the knee flexion, I can allow that ankle to flex back to kind of shorten that stride a little bit. You want to try and focus on the ankle motion, so it's almost like a scooping and then a flexing, a scooping, flexing action through the ankle as much as you're working on the knee. Now, of course, if you just don't have that kind of range of motion through the knee, usually what I would do is I would have my client rock. This is what we call rocking. But I would still try to get them to rock on top and then rock on the bottom. So if you think of that pedal as a clock, this is the 12 o'clock position, this is the 6 o'clock position. I'm really looking for that client to kind of get back to, let's say, 11 o'clock, maybe even 10 o'clock, and then scoop all the way around to maybe 9 o'clock, 8, 9 o'clock. So you're getting most of your motion here. Now let's just say, absolutely not, Tony, I just can't do it. No problem. You scoot that forward. So now my non-surgical foot, the ball of the foot and the toe is on the pedal. On my surgical side, my heel is on the pedal. And if you look at my joint angle, I'm nowhere near 90 degrees. I'm probably somewhere closer to, I don't know, 60, 70 as I come around. And then what happens is I rock on the back end of the circle. So I might go from 6 o'clock, come all the way around to 12 o'clock, 1, 2, maybe even 3 o'clock, and then come on back. So there's lots of different ways to kind of play with your foot placement, with your body placement. Certainly we don't want you to lean far away and kind of use this compensation to get all the way around. But if you need to do that in the beginning, and I kind of rock away and then I come back onto it until eventually I can stay in the center, it's okay. It's okay. There's no such thing as cheating, as long as it's not dangerous. And your physical therapist will be able to tell you the difference between compensation, cheating, and danger. Leaning away for a minute or two as you get warmed up and then starting to kind of settle into the middle, it's just fine. Don't worry about it. What else can we do? So one of my little tips and tricks is first understanding your alignment relative to the ankle, the knee, the hip. I try to explain to my clients frequently that when I'm on the bike is nothing like walking. Okay, if I was going to measure from the center of my ankle on my right to the center of my ankle on my left, I'm going to have almost 10 inches, maybe even 12 inches of width. When I'm walking, I'm almost 2 to 3 inches, maybe 4 inches in width. Walking is a very different position relative to the hips, the knees, and what your body is doing. So don't try to use pedaling a bicycle to improve your walking. They're completely different, but that's okay. They both have benefits. So one of the things that I like to do is get a strap. This is a non-stretchy strap. You can put that loop around the foot while the foot's on the pedal. As I come up here, I can work on my calf stretch. I can work on elongating the knee, feeling the stretch behind the knee, while I work on pulling back at the ball of the foot, and then I relax it, and then I work that stretch again, and I relax it. Super easy, super common. Another one that I like to do is I have my handy dandy rolling pin. And so let's say you've been rocking for a while and you just feel like, oh, I just can't get it over. No big deal. Get it into that end range where it's a little bit uncomfortable but not painful. And then from here, work, especially with the pressure going from the knee back to the hip. And so what I'm doing with this is I'm doing a couple of things. Obviously I'm moving fluid, right? I'm compressing the tissue, I'm getting that fluid from the knee down into the thigh, back up into the system. But I'm also kind of desensitizing some of those muscles that are in that guarded, protected phase. You know, your nervous system is there to protect you. And as you get close to that end range, your nervous system is throwing up all these red flags and driving that pain response to say, hey, stop, you're going to tear something. You know logically you're not, but your nervous system doesn't know that. And so what the sensation of the pressure does is it kind of gives you something else to feel. Not just the sensation you feel on the knee, but the pressure from the rolling pin. And it feels nice, and it's kind of a good hurt, a good sore. That's usually the explanation. Certainly you can get here behind. And when you're working the back of the hamstring, almost always, what you're gonna find is that that leg sneaks around and oh my goodness, you just did a revolution. And it didn't even hurt because you were working on massaging the back of that leg. And it just comes right around, easy as butter. Of course, I can also work down into the lower leg, the calf muscle. I can come out here on the outside, kind of this meaty part. What I usually explain is that we don't have any benefit on massaging the bones. So rolling on the shin bone doesn't help. Don't push it, don't do it. Rolling over the knee, the kneecap itself, there's no benefit. But any of the soft tissue areas, any of the squishy stuff, if it's squishy and mushy, you can massage it and it's gonna help. So using the rolling pin while you're on the bike is a great way to kind of bring a new element into the picture to help you gain that range of motion. Once I finish, whether it be 3 minutes, 5 minutes, 10 minutes, whatever your duration, once I'm like, hey, I'm done, I'm checking out, okay, perfect. The biggest risk factor in the clinic for injury is tripping when you get on and off the bike. So when we're getting off the bike, we always want to slide the seat back as far as we can. We want to take our non-surgical leg, bring it over. If your surgical leg is feeling strong, that's fine, bring it over. Doesn't matter, but you want to bring both legs over while you're sitting. You don't want to stand and then try to bring the leg over. And then from here, we go ahead and stand up. One of my favorite little tools, I think we still have it in the camera, this little wedge. So this little guy, it's a little wedge. I'll post a link in the comments. I get these for like $5 or $6. They're super cheap. They're super lightweight. They're just plastic. But they work amazingly well for calf stretch. So I throw it back in there. I put my surgical side on there. I bring my other foot alongside. I stand up, can't see me, stand up nice and tall, hold it for 30 seconds to a minute. I can do it with the knee bent. I can do it with the knee straight. Either one, both of them are going to be beneficial. So just to wrap things up, the bike is a wonderful tool. That's all it is a tool. You can use that tool the way you choose. A hammer could be used to hammer a nail. A hammer could be used to break a window. It just depends on how you choose to use it. So there's a difference between pain and discomfort. Only you know the difference. Take your time. Every day should be steady progress, moving in the right direction. Yes, there'll be exacerbations, there'll be flare-ups, there'll be days where you feel like you're falling behind. Don't worry about it. That just means you're getting ready to move forward. Okay guys, thanks again for watching this video. If you have comments, questions, concerns, please post them below. Otherwise, I'll catch you in the next video.